the action which you have decided before reaching to goal, you stop. Okay. This is very interesting. So because I told you what is the benefit of developmental psychology, because you are very, very professional in cognitive skills and executive function. You should know how this executive function deforms. This is the time how inhibition skill develops. This is the inhibition skills. How it develops from the birth. For example, 1 year, 2 year, 3 year, 4 year, 5 year, 6 year, 7, 8, 9, 10. Here is what? Preschool. Child. What do we call? School age or adolescent. Yes? Very good. So, it's very interesting that the inhibition skills develops very fast very fast during childhood. It means that, see how you can understand that how much important some skills is for life. I told you, for example, emotion develops very fast, even at the start of the birth. It shows that emotion is very important for protection and keeping the life. It's very interesting that inhibition also grows very fast during childhood, but continue after childhood, but in linear, more slower rate. It means that during 6 years, this develops rich here. Most of the development happens in preschool age. But after next 6, you will reach this point, for example. For example, during school age. So in first 6 years, the development is in this much. Very fast development. But development in the second 6 years is here. It means that very fast development happens for inhibition skills. It means that the child skill in inhibition is very high. Very high. It shows that inhibition is very important, and when the patient is 6 years old, the inhibition skills is developed in good quality. In good quality. This is very important. Some difficult question I can give you, but if I wrote this diagram for you, you can learn it. So again, I want to review, because executive function is the most complex part of cognition. But you should learn that, because this is your job. So, inhibition is a part of executive function that you inhibit, you stop the action which you have decided before. But before reaching to goal, you inhibit yourself. And very important executive function. And that's why during childhood, the development of inhibition is very fast. It's very fast. You know that in some neurodevelopmental disorders which involves prefrontal lobe, all the executive function is from prefrontal lobe. All the executive function. And for example, in autistic patients, some of them, they have some problems in inhibition. So sometimes they have some reckless behaviors. They do some reckless behaviors, and it's very dangerous because inhibition is stopped, it's disrupted. This is inhibition. Okay. I think this is the most difficult part of the lessons I have had before till now. Okay. The other. So, this is executive memory. Mostly we use the word working memory, not executive. But executive memory is you understand executive function. I told you what is working memory. It's a little difficult to understand. In the slides, in the past class, I explained for you what is working memory. Here you can review it, that what is working memory. First of all, working memory is a process of recording information from decision making till reaching to the goal. And it's very important because for the best decision making, you know that we have some classes, some courses, we call it promotion in decision making. You know, for a lot of business planning and such, these courses, that how you can improve decision making skills. One way is working memory, because working memory records all the informations which you need during decision making. Because decision making based on all the facts is happening during decision making. And it's very interesting that working memory is unconscious. You are not aware that you are recording these memories. It's unconscious. And equivalent to short memory in conscious memory. Do you remember that we have two types of memories? Conscious and unconscious, and different stages of memory. Let me remember you, because this is again another important thing that you should learn. For permanent learning and long-term memory, you should go through different types of memory. We call it sensory memory, which is immediate. Just for some seconds, it remains in your mind. Then, short-term memory, then long-term. I want to tell you that working memory is very important in you. Very special jobs you can do through working memory, I tell you. Long-term memory. I know this is very complex, but now you want to work on a new approach or modern occupational therapy with neuroscience approach. I will tell you what is the benefit of knowing what is working memory. Okay. I told you that any skill you give to your patient is a process of learning. And learning is a process of memory. So, for any learning happens, you should go through these steps. First, you need sensory memory. A good senses and good attention. So, for increasing sensory memory, you should have some strategies. We call it sensory enhancement strategies. And also attention enhancement strategies at first step. because you want to give some skills to the patient. So, for reaching to this long-term memory, which, for example, some skills you want to give to your patient, at first step, you need sensory memory or immediate memory. So, you need good senses and good attention. The next step, before reaching to long-term memory, you should have short-term memory. For conversion from sensory memory to short-term memory, what is sensory memory? Remains for a few seconds. What is short-term memory? Remains for a few minutes. What you need? Again, attention. Again, attention. What is long-term memory? Remain for a long time. For long-term memory, we have a term. You need rehearsal. What is rehearsal? Practice, exercise, repetition. So this is the process you should go for your procedures. Who pay attention to this one? No, nobody. But we are talking about neuroscience approach. First, you should have sensory enhancement strategies to improve sensory function of the patient. Then, attention enhancement strategies to improve attention for what? First, then, with sensory memory, the patient collects all the things he needs. While attention send it to short-term memory networks, then by rehearsal and repeat, send it to long-term memory. This is the process. And you can see, especially here, and especially here, you need cooperation of the patient. You need cooperation because this is the process of conscious learning. This is the process of conscious learning. Who knows in conscious learning which part is responsible for making short-term memory? Which part of the brain is responsible for conscious short-term memory? Who can remember? Hippocampus. It's not necessary. We will talk about that in neurophysiology. This is not at this level. Hippocampus. In neurophysiology, we will learn. But I told you that most of the time, when you are working on cognitive skills of child, you cannot have cooperation of the patient. You should use another learning, which we call it unconscious learning. For unconscious learning, again, you should have first sensory memory, but it is not aware of he is learning. But first, sensory memory. Receive some information from visual, auditory systems, but can record this information just for a few seconds. Then go to short-term memory. What do we call it in unconscious learning, short-term memory? Short-term memory. In unconscious learning, we call it what? In unconscious learning, short-term memory is what? It's very interesting. We call it working memory. So, working memory, in fact, is short-term memory of unconscious level. And as you mentioned, is one of the most important aspects of executive function. It means during decision making, you decide based on what? What is happening around you. How you record this information and use this information during decision making. It means that for a short period of time, this information should record in your prefrontal lobe, and then you decide based on this information. What is the site of working memory? Prefrontal lobe. So, working memory is short-term memory in this stage. It means that during action, during decision making, you record the information which are perceived by sensory system, but it keeps in your memory for a short few minutes. But what is the benefit? Because for decision making you need. For planning you need this information. For problem solving you need this information. Even for inhibition you need this information. You receive some new information that you understand that you should stop. For shifting is the next part. For shifting again you need working memory because you are receiving some information, and this information should keep in your mind, record in your mind for few minutes for decision making, for planning, for problem solving, for stopping, inhibition, shifting. This is one important job of working memory as a part of executive function. So without working memory, how we want to decide? Decide based on what? The most important aspect in decision making is what is going on around you. But another part which is important in working memory is here, as I mentioned, some strategies in occupational therapy. Another part I taught is in your occupational therapy strategies, that you want to reach some skills by working memory networks. First sensory memory, then working memory, then some skills. For example, these skills can be stored in the striatum, in cerebellum, in prefrontal lobe. This is working memory. But this is working memory or executive memory. The ability to record and return information for a few minutes. For what? But unconsciously. Unconsciously. For what? For executive function, decision making, problem solving. What is the site in prefrontal lobe? So, how it develops working memory? What do you think? You know that working memory also develops during neurodevelopmental period. How it develops? This is very interesting. I told you, inhibition develops at first very fast, but after a school age, it will be linear and more slow. But development of working memory is much more linear. It's like that. the working memory will be like that. Linear. It means that during a school age, you have such this development. After a school age, in adolescent, again, the same. We call it linear. So I know it's a little complex, but you should know that development of working memory is linear throughout adolescence and childhood. It means that in the first 6 years you have some development, and the same in the next 6 years. This is about working memory. And working memory, I told you, you can use working memory in your strategies, in your occupational strategies, for better skills, for improvement in function. This is working memory. Any question? You can compare development of inhibition with working memory. Inhibition develops much more faster in comparison with working memory. We can give you some. You know that the slides is very, very limited. 5 to 6 slides from emotional, 5 to 6 slides from the other aspects of cognition. All the questions are from these 7 or 10 to 12 slides. Okay, another thing. You understood what is working memory. The third, see, we call it core executive function. I know. The third core, this is very interesting word. Core of executive function. In some texts, we consider inhibition, working memory, and shifting as core of executive function. It's very interesting. We call it shifting. What is shifting in executive function? We said in alternating attention. Alternating attention means you shift your attention from one stimulus to another stimulus. What time? After reaching to goal. After reaching to goal. But here shifting means before reaching to goal, you should shift your attention to another way. And this is one of the core functions of executive function. And somebody says that this is for controlling for your working memory. I told you working memory is recording the environmental information during action, and you use them during decision making and working memory. But you have some controller of this working memory, that to which stimuli and information you should pay attention and record. This means 3 minutes. So this means 60 minutes, means 5 minutes. It's very, very important to control your behaviors. But again, this is interesting that shifting ability mostly develops during adolescence. This is interesting. See how, let's see here, I wrote this chart for you to completely understand the difference between. It's interesting that shifting skills develops very, very little during childhood. It it means that in childhood you are here after 6. But it develops very fast after childhood, in preschool age. So, which of these skills are in highest level in preschool age? Inhibition. Which are in the lowest stage in preschool age? Shifting. But after preschool age, it will develop very fast. So in preschool age, first, your development is here, but after that, increased development. By this chart, you can understand what is difference between development of different, what do we call these 3 core domains of executive function? Core domains. So your job is mainly on executive function, and core domains of executive function includes inhibition, working memory, and shifting. So your shifting skills is still weak at the start of school age, but inhibition should be very powerful. Should be very powerful. But after adolescence, all of these skills reach to its mature stage. For example, in 11 to 12 years old. And at that time, your executive function is very powerful. Before that, because working memory is weak and shifting is weak, you cannot do very complex behaviors. Although if you feel some danger, you can inhibit. This is protective. This is protective. Okay. This is the development of executive function. I want to give you some new aspects, and not in the slides, just I want to talk about something because I told you that you should think also about some new aspects of occupational therapy and research. In which topics you can have research? One of the most important in developmental psychology, development of IQ. What is the most important aspect of IQ I told you? Exactly. How you can upgrade the executive function? No, some strategies. Increasing inhibition skills, increasing working memories, increasing shifting abilities. And some text believes on that the most important measure of executive function is problem-solving ability. But for sure, for problem-solving, you need core executive function domains. For better problem-solving, you need better working memory, better inhibition skills, better shifting skills. So how you can upgrade problem solving? This is one of the aspects of your modern parts of your job. But the other things, development of EQ. Which means mostly the most important measure is emotional regulation. And all these parts you should work on what? Prefrontal lobe. And mostly dorsolateral prefrontal lobe, DLPs. These are some things which I want you just think about that. That for in developmental psychology, development of IQ, development of EQ, the most important part of the brain is dorsolateral prefrontal cortex, which has effect on problem-solving skills and emotional regulation skills. Just think about that, because these are some modern aspects of developmental psychology which are completely related to occupational job. And if you want, as I mentioned, I am thinking about establishment of some student club, neuroscience student club, especially in your field. That you, from now, you can argue that my occupational therapy is with neuroscience approach, and which is the most modern and promoted and advanced type of occupational therapy, which you can change the name of your job, cognitive therapy. So these are new aspects. So if I want to say about, because this is the last session of developmental psychology, but we have still 2 sessions about adult psychiatry, which we will review anxiety disorder, personality disorders. But this is the last session of developmental psychology, and for sure most of the questions will be from the slides of emotional development, attention development, memory development, language development, and executive function development. Most of the questions will be from these slides. I think 20 questions is enough. And inshallah, all of you will have complete marks, because very limited slides and very comprehensive explanation. But this is not our aim. Our aim is that step by step you should enter the neuroscience approach of occupational therapy. First, you should know about development of cognition, then what are the diseases of cognition in adult psychiatry, and then approach treatment strategies based on this knowledge. If you don't have any question, we can finish the class before all of you leave the class. So, because I don't like you to go to Jahannam, I like you to go to paradise. Duzak, you say? Jannah and Jahannam. Okay. For sure, I prefer you go to Jannah. Jannah. See you in Jannah. Salaam alaikum. We say salaam alaikum. So euphoric and wow, and now control yourself.
Inshallah, all in Jannah. All men.
Inshallah. And the students.